My name's Michelle Smith. I'm 50 years old and I'm a regional human resource manager. And I've been suffering from TMJ, I would say, since my early 30s. But not so severe that I couldn't cope with it. It was just occasional. It was clicking when I'd close my mouth, and occasionally my jaw would lock up and I'd have to wait for it to relax. So, you know, I've noticed in the last several years that this was getting a lot worse. And so I talked to my dentist about treatment, and he made me a night guard to wear, which lasted about 2 weeks till my dog found it and ate it. And I just didn't get one made again. And so this year, the problems were really getting more and more severe. I was having, my jaws would ache at the end of the day, and felt like I had ground glass in my jaw. Every time I talked, when I'd yawn, when I'd eat, I could hear the grinding noise. It was constant and it was driving me insane. So I talked to my dentist about 6 months ago at my appointment, and since he doesn't treat TMJ, he referred me to another dentist. That dentist didn't treat TMJ either, so he referred me over here to Dr. Cory. So I made an appointment for a consultation and talked to Dr. Cory. He told me about the different forms of treatment that they do, and that he had success with putting an appliance that kind of realigned the patient's jaw so that to relax the muscles and realign the jaw and kind of correct the overbite or over extension of my jaw that I had going on. So I made an appointment for the next day, which happened to be my 50th birthday. The office was really sweet. They had a birthday card for me and everyone wished me happy birthday. And I came in that day, they took some x-rays, and then they hooked me up to a TENS machine that would help relax my jaw and applied heat to it. And the theory behind that it would relax the tight muscles, the tension that I had there, and then we would take a mold of my jaw in the relaxed position, not fully closed, but maybe where it should be, if it was not overcorrecting. So that was about an hour, and then they came in and they took a mold. We took a few molds to make sure we got the right fit, the right angle. And then I went away, and a few weeks later they called me in. The mold was here, and Dr. Cory put it in. He made sure that my jaw closed right and that both sides were meeting, and told me to come back in 30 days. So I wore it every day for 30 days, took it out to eat only, and initially it was awkward. I talked funny, my husband thought it was cute, but I got used to it pretty quickly and got to the point where if I didn't have it in my mouth, I felt like something was wrong and I went looking for it. And I made sure to put it in a case when it wasn't in my mouth so my dog couldn't eat it this time. And when I came back for my 30-day appointment, Dr. Cory was talking to me about other patients and different forms of TMJ and different pain and things they'd suffered from. And he mentioned headache and neck aches and back aches and different body pain. And it was at that point that I realized I hadn't woke up with a headache in about 3 weeks, and I didn't have neck pain anymore. And it had been such a chronic part of my life, like every day, neck pain right in here. The only time I'd ever had relief from it was when I was doing yoga. So I was pretty convinced at that point that this was gonna work. Now I'm 4 months in, and again, the jaw pain, the headaches, all that is gone. And I still, I think I still have a little ways to go. There's still some discomfort when I'm eating really chewy foods, or if I yawn really big, I have to kind of keep it under control. But I feel like the appliance has been a lifesaver. It's stopped the progression of my TMJ. So I'm really happy with Dr. Cory and his staff and how kind they all are, and I'm really glad I was referred over here.